Hi there, everyone, and thank you so much for joining us today. Before we begin, I'd like to acknowledge the traditional owners of the land on which we are meeting and pay my respects to elders past and present. I also extend that respect to any Aboriginal and Torres Strait Islander people watching this video today. It's now my pleasure to introduce our speaker, Professor Danielle Mazza. Professor Mazza is an internationally recognised clinician researcher and head of the Department of General Practice at Monash University. Her work has had a significant impact on improving women's sexual and reproductive health, preventative care, and the quality of primary health care in both Australia and internationally. Please join me in welcoming Professor Mazza.
Thanks so much. I'd also like to say hello to everyone and welcome to Quendo's Manage Endo. It's great to speak with you today about endometriosis care in general practice. I'd also like to begin by acknowledging the Boonwurrung people of the Kulin Nation as the traditional owners of the land on which I'm presenting from today and the land on which the Endometriosis Management Plan was conducted. I pay my respects to their elders past and present and Aboriginal elders of other communities who may be here today. Please note, just a disclaimer to start, that this presentation does not replace treatment provided by medical or allied health professionals, and the treatment of endometriosis responds best to multidisciplinary care. So please consult with your health professional before commencing with any of the information provided. So a little bit about me. My name is Danielle Mazza and I'm a GP and the head of the Department of General Practice at Monash Uni. In the department, I'm the director of the Sphere Centre of Research Excellence in Women's Sexual and Reproductive Health in Primary Care. My research work has contributed to significant advancements in general practice and primary health care in Australia, particularly in the field of women's sexual and reproductive health. And I've had a haircut since that photo was taken. I'm a proponent of evidence-based improvements in patient care through guideline development, implementation, and development of fit-for-purpose models of care and tools to aid patients and clinicians at the point of care. General practice is often the first point of contact for patients with the health system, which is why it's so important that we get it right to be able to best deliver high quality, safe and accessible care and achieve better health outcomes for women's sexual and reproductive health. But enough about me. I'm pleased to have been invited here today to speak about endometriosis in primary care and to let you know about something that is heading your way, an endometriosis management plan, which will be accessible to you via your general practice. But first, I've been asked to share my top tips and strategies. When thinking about these, I thought, what are the most important aspects of endometriosis diagnosis and management in primary care that we need to improve? So our number one focus is to try and shorten the time to diagnosis. We know that historically the time to achieving a diagnosis of endometriosis is far too long, and there's been a lot of work focused on addressing this. And a major aspect of that has been raising awareness of endometriosis symptoms and the impacts that it has on people's lives. With this in mind, my number one top tip would be to seek help early and speak up if you think your symptoms are not normal, and speak up if your symptoms are having a negative impact on your life. Make this known to your GP and use your GP as the first port of call. Don't be afraid to have that first conversation and don't delay. My second top tip is to be your own advocate. If you seek help and feel that you haven't been heard or your symptoms have been discounted or normalised and this doesn't sit right with you, try again. Seek the support of a friend or family member and see your GP or another GP if you need to ensure that you are heard. Number 3, ask about the treatment options that can be started early. Treatment of symptoms can be initiated for a suspected diagnosis of endometriosis. The diagnosis of endometriosis is really made based on the history, what you report your symptoms are to your doctor, examination, and potentially through the use of imaging tests like an ultrasound. While laparoscopy, which is keyhole surgery, has previously been the gold standard to make a diagnosis of endometriosis, it's not necessarily required if the clinician can gather sufficient supporting evidence through the clinical consultation, talking to you, examining you, and the use of imaging like ultrasound. Number 4, ask your GP how an endometriosis management plan can support you. And ask your GP or the nurse in the practice to help you to diagnose and manage your chronic condition. From May 2026, a tool called the Endometriosis Management Plan will be available for use through your general practice. And this is going to help your health professionals to diagnose and manage your condition. So a little bit about the Endometriosis Management Plan project. This came about under the National Action Plan for Endometriosis's Call for Action, and it's been conceived and funded by the Department of Health, Disability and Ageing. The Endometriosis Management Plan has been designed to help consumers and general practice-based clinicians to identify and manage endometriosis and chronic pelvic pain in primary care. It's been a 3-year project which has involved consumer and GP input from start to finish. We were tasked with scoping the literature to understand what management plans were already out there, to understand what was currently happening in the diagnosis and management of endometriosis in general practice, and to hear from consumers, GPs and stakeholders via focus groups and interviews what their experiences and needs were. We then held a co-design workshop with consumers, GPs and stakeholders where the format and the content of the Endometriosis Management Plan was designed. We've been working with software developers to bring these ideas to life, and we've piloted the tool with 8 GPs and endometriosis and pelvic pain clinics, and we've sought feedback from GPs and consumers about how the Endometriosis Management Plan worked in practice through interviews and survey forms. This feedback has then been used to further refine the management plan, ready for national rollout. So what is the Endometriosis Management Plan? It's a patient-centered, electronic, interactive, web-based online tool accessible for GPs via the College of GPs website. The Endometriosis Management Plan aims to support the diagnosis and management of endometriosis and chronic pelvic pain for both providers and patients in primary care. We are seeking to empower consumers and clinicians to work together to improve endometriosis diagnosis and enable more holistic care. This evidence-based tool has been informed by our research and includes recommendations straight from the Australian Living Evidence Guidelines for Endometriosis. The plan allows for shared decision-making, making you, the consumer, a partner in the process and enabling access to information for both the consumer and the clinicians. Along with accompanying College of GP educational webinars and e-learning modules, clinician resources are embedded in the Endometriosis Management Plan to support GPs and nurses to better recognise and treat the condition. Using the management plan is a step-by-step process for consumers to complete with a general practice-based clinician, either a GP or nurse, in a general practice consultation. It is designed to support both the consumer and the clinician. It can be used for patients with suspected or confirmed endometriosis or chronic pelvic pain. So ask your GP if you can complete the endometriosis management plan together. Your GP can assist in determining if this is the right tool for you, taking into account the duration and nature of your symptoms and your Medicare eligibility. All GPs can access the tool via the College of GP website, regardless of whether they are a member of the college or not. So a little bit about how it all gets done in practice. You'll work together with your GP-based clinician, either the GP or the nurse, to complete the endometriosis management plan. Your personal identifying details are only added once the output information is downloaded, added, and saved to your practice-based medical record. Completing the plan involves a number of steps. First, you work with the clinician to enter the following initial information: a record of your consent and the date on which the plan is being completed, to compile a list of other active health conditions that you might have, to list your past medical history, your family history, what current medications you're taking, whether you have any allergies, and what previous managements you have tried to help you control your symptoms with regards endometriosis and/or pelvic pain. The type and date of relevant pelvic imaging and surgery that you might have had done will also be entered. And there is a space also to record any other relevant preventive health screening tests that might be appropriate. Next steps is to work with the clinician to enter a record of what your main symptoms and concerns actually are. Then together you discuss your goals that relate to those symptoms and concerns and document them in the plan. Assessment tools in the form of questionnaires will be offered to assist in measuring the severity and the impact of the symptoms that you have. Your clinician will then discuss with you the relevant patient resources that you have available to you to provide you with further information about your condition and provide links or printouts of the resources that you find suitable. Together with your clinician, you can discuss, choose, and enter the relevant treatment and self-management strategies that you will pursue for your condition. Your clinician will also discuss any relevant referral options for specialist or allied health services that might be applicable and arrange referrals as appropriate. Together, you review the plan before it is downloaded and finalised and saved to your medical records. You'll be provided with a copy of your endometriosis management plan, and copies will be shared with healthcare professionals involved in your care. So everybody's got the same information and is on the same track. The endometriosis management plan has been designed, tested, and refined to be suitable for use in a GP consultation. There have been recent revisions to Medicare rules for chronic condition management planning, and your management plan can remain valid indefinitely and can be reviewed every 3 months with your general practitioner, with or without input from your practice nurse. If you move practices or your care needs change significantly, a new endometriosis management plan can be created as needed and in accordance with Medicare billing rules. The consultation when the endometriosis management plan was completed by you and your clinician will be billed using the corresponding Medicare item number. Whether you end up paying a co-payment or whether you are bulk billed is dependent on what your practitioner decides in line with their practice billing arrangements and your Medicare eligibility status. So the Endometriosis Management Plan is due for launch in May 2026. And from then, it will be ready for national use in all general practice settings. I hope that's answered some of the questions that you might have about the Endometriosis Management Plan and that you utilise it and benefit from it for your care. Thank you.